Hi, I'm Vicki Blanc, and I'm the director of the Central Biorepository. I'm here today to tell you a little bit more about the CBR and how we help researchers do their jobs. Our mission is to facilitate discovery and improve healthcare outcomes by providing high-quality, highly annotated biospecimens donated for clinical, basic, and translational research. We offer our researchers at the U of M several things: standardized biospecimen storage, management, and processing procedures for high-quality materials, shared access to hundreds of thousands of biospecimens collected across the medical research enterprise and contributed by our investigators, biospecimens linked to clinical data via the electronic health record for increased scientific value, and we offer technical and regulatory expertise to our faculty starting up a biorepository program. So how do we do all of this? First, we populate the biobank through investigator-initiated biospecimen programs. To them, we supply a uniform broad consent which enables wide-spectrum use of the biospecimens for now and in the future. We've also obtained an NIH Certificate of Confidentiality to protect the privacy of research participants, and which also prevents us from being compelled to disclose any research data regarding our participants. Next, we facilitate sharing, and we do this by featuring the composition of the biorepository inventory on our website so investigators can see what we have. We enable investigators to discover available biospecimens through the medical school-sponsored Data Direct cohort discovery tool. And finally, we connect researchers wishing to use the samples with researchers creating the collections for additional data sharing and collaboration opportunities. Critical to our work is approved and compliant transfer of biospecimens. All programs contributing to the CBR create an oversight committee which evaluates requests to use biospecimens from that collection. So principal investigators retain control over what circumstances samples may be shared with other researchers. Of course, whenever you're working with human subjects in research, you need to obtain IRB approval as appropriate. We facilitate and provide guidance on how to do that too. The CBR is accredited by the College of American Pathologists Biorepository Accreditation Program, which means you can have confidence in our quality management principles and the biospecimens you are obtaining from us. So what types of samples are available? You can go to our website and navigate to the View Inventory link on our homepage. When you click that, you will get a view of the sample inventory. Across the top, you see the types of biospecimens that we have, and across the left-hand panel, you see the primary research cohorts that they were collected from. You'll also see the number of samples within each and the total number of samples overall. So this is an overview of what's available, but what if you have an interest in biospecimens from people with certain phenotypes or clinical characteristics? Well, you can also search for specific cohorts of Michigan medicine patients with biospecimens using the Data Direct Cohort Discovery tool. You can filter out patients by demographics, comorbidities, diagnosis, etc., and then filter by the types of samples you are interested in from those patients. You'll receive back counts of the patients who have those types of biospecimens. Once you've done all of that, you can ask for access to those specimens by completing a use proposal form on the CBR website and send it to CBR requests. We will then send it to the appropriate steering committee for their approval. The Central Biorepository also serves as a custodian for two NIH-sponsored collections, each with their own procedures for access. These are the Nephrotic Syndrome Study Network and the Clinical Phenotyping and Resource Biobank, CPROBE and Neptune. Since they have their own individual access procedures, you can find out how to obtain biospecimens from them via our Get Access webpage on the website. So to summarize then, check out our website for contributing bioprograms and available biospecimens. Search for clinically defined biospecimens through the Data Direct search tool, and submit a research proposal to request access to the biospecimens that meet your needs. We operate as a core research unit subsidized by the Office of Research. For investigators looking to access sample, a typical pull of 96 samples with an aliquot step would cost about $250. All of our rates are on the Get Access webpage. Page on our website. We are proud to serve all members of the entire University of Michigan research community. There's lots more on our website, so please scroll through or contact us for a consultation to learn more.